Alright, so good news for the 1 in 13 Americans that are currently dealing with asthma. If you have commercial insurance, you might finally be able to afford the inhalers that are part of the new recommendations. So as a reminder, there was an update in the Global Initiative for Asthma and different asthma recommendations for inhaler use. The most commonly prescribed inhaler was albuterol, which we call SABA, which stands for short-acting bronchodilator. I would think about this like a plunger, especially when the lungs are closing off. You take a puff of it and it'll open the lungs up temporarily, and this is usually used every 4 to 6 hours as needed. While it's okay for short-term symptomatic relief, it's not really great for reducing an exacerbation. So the recommendations were updated in order to allow for this medication called Symbicort. Now its generic name is budesonide formoterol. The benefit for this medication is that it works really rapidly, but it lasts much longer than albuterol. It also contains a small dose of a steroid, so it also helps reduce the risk of an exacerbation. This inhaler can be used as needed and as a maintenance inhaler, so it's actually one of the superior inhalers that are used for asthma. The problem is there was a monopoly. 17 years of rights were given to AstraZeneca, who had the patent on it, and then also got exclusive rights for 6 months into 2023. So luckily this month we finally have the release of a generic Symbicort. Now without insurance, it's still pretty pricey. It's probably going to average around $200 a month without insurance. But with commercial insurance, it should offer a cheaper option that might be an alternative to other inhalers like Wixela or Advair, which might be inferior in their onset of action compared to formoterol. Because of the onset of action, an allergist might recommend this both as needed and a maintenance inhaler, so it might let the person not have to carry around albuterol as well. Now in the US, inhalers are really expensive, so I hope more medications take over the market so that us asthma doctors can have a lot more to choose from and patients have more. Hope that helps.